Number of infections for COVID-19 continues to rise in our area, and local hospitals are seeing an increase in patients.
Today, WJCL's Dave Williams had a chance to talk with Memorial Health's infectious disease specialist to get a read on what's causing all of this. Dave?
COVID-related cases at Memorial Health are on the rise, back to the numbers of the early outset of the pandemic. As of Wednesday, Memorial is treating 57 COVID patients as the amount of positive cases continue to soar for this area.
Some of that is increased testing, but probably the biggest part of that is increased community spread. So when you have that happening, you've got more folks in the community becoming infected, you'll see more people be admitted. And so we're experiencing that now.
But if there is one bright spot, they are seeing some less serious cases of the virus, mainly because the age range of patients is changing.
It's really been in the 20 to 40 age range patient who thankfully is not as critically ill as some of our initial patients when this pandemic began. And so with that, our ICU numbers haven't really significantly risen compared to where they've been in the past.
Now, even though there's been an increase in the amount of patients here at Memorial Health, the hospital still doesn't anticipate that they'll need to institute any kind of surge plans to compensate for added patients. But if that situation were to arise, they're prepared.
We have sort of mapped out using our own physical space and the staff that we have on hand and how we would repurpose what people are doing and the type of patients they might see in a safe way to meet the needs of up to 150 ICU patients.
Right now, though, Memorial is nowhere near that number. They have a total of 74 ICU beds, not all of which are being used, and only 13 of those by COVID patients. In Savannah, Dave Williams, WJCL 22 News.